Hey everyone, today I want to show you my favorite printer for 2025, which is the Phrozen Sonic Mini 8KS. Now, I like the Mini 8KS because it gives really high quality prints. It has a really good motor, really good light source, and it has a Z-axis, which is very accurate. And those are three factors that are really important in any printer. Now, this typically runs under around $300 for the printer itself, but in order to get the most bang for your buck, there are some modifications that you are going to want to make to this 3D printer. One of them being is a vat warmer. This is a vat warmer created by Dr. Rick Ferguson. You can currently buy it on medidenta.com. And what it's going to do is heat the resin so that the resin is less viscous, and a less viscous resin will flow underneath the build plate, which is going to allow you to print faster. One of the biggest restrictions to speed is how viscous the resin is. So that overcomes one of the obstacles. Another modification that you can make to this printer is adding the Ferguson mini vat. The Ferguson mini vat essentially is going to shrink the size of your vat, and if you compare this, which is going to hold probably half a liter, let's say, to the mini vat, which is going to hold probably a quarter of that and condense the size of the area, is going to, number one, save you a lot of resin. It's also going to increase pressure into that resin vat so that the resin is going to be forced to flow underneath this plate a little bit faster, which is also going to allow you to predictably increase the speed at which you're printing. So basically, you're printing faster when you add a mini vat. So you have the mini vat warmer and you have the now mini vat. Finally, the modification that you're going to add is the Ferguson mini plate. And the mini plate, if you compare this to a traditional plate over here, you can see this is about 25% of the size. Now, the smaller the build plate, the faster you can print because resin is going to flow underneath the build plate to get to the area that you're trying to print. So essentially, less viscous resins let you print faster, and you do that by heating. Smaller build plates and smaller vats also increase the speed at which you can go. Now, that's basically the premise behind a lot of the really expensive dental printers is they build in heaters, they build in small plates, and they build in small vats. So by adding these modifications, probably less than $1,000 is my guess, you can get a $10,000 to $15,000 printer, in my opinion, that is going to give you the exact same quality. So when I have all of those modifications, that's what I use for printing anything tooth colored, essentially. So in this case, I'll be using Rodin Titan, Rodin Sculpture. Most of the things that I want to speed up for same day dentistry or want real high predictability, I'm going to have the vat warmer, the mini plate, and the mini vat. When I come over here and I'm using Key Splint Soft, I find that I don't need to print this resin heated. It's really predictable unheated. So I don't have any modifications to the heater. I also did not modify the size of the build plate. So you can see the larger build plate, larger vat. Now, I do that because when I'm printing a night guard, there's typically no rush. So it doesn't matter to me if it takes 2 hours. So for a typical night guard, you might take an hour to 2 hours to print. But again, there's no rush. When we come over to the tooth colored resins, you can print a 3-unit bridge or a crown, things like that, in about 20 minutes. So big difference when you add those modifications to the speed and predictability. So white resins are typically the least predictable resins, which means they have the highest failure rate. So you want all those tricks to help increase your success rate. Key Splint Soft, again, not really a difficult material to print. Highly successful, in my opinion. When I come over finally to my surgical guide resin, I like to use NextDent Surgical Guide. It's very predictable in my hands. I've been using it for years. The success rate is very high. Very seldom do I have any print failures using NextDent Surgical Guide. But I do heat my surgical guide resin, and I also have a mini plate. I probably will be adding the mini vat as well, but I haven't done it yet. But this is super predictable. Sometimes I will switch from the mini plate to the traditional plate in the event that I'm printing multiple surgical guides at a time. But again, that's pretty rare. So you can see I have the full lineup: Key Splint Soft, surgical guide resin, dedicated printer, and I also have dedicated sculpture, and in the other room I have a dedicated Titan. So I like to have one printer per material, one printer per shade, because again, these printers come in at such a good cost-effective price that for me to switch out the vat, dump the resin into one of these containers, pour a new resin in, clean everything. It's going to take about 10 to 15 minutes. And for me, to just buy an extra printer, if you have the space, is much more beneficial. If you're printing models on either one of these printers, you probably don't need to heat it. You just buy a resin. In my case, I'll use Phrozen Aqua series, which is a very fast, highly predictable, highly accurate resin that's really thin. So it can print really fast, really predictably. You can usually print 2 models if you print them horizontally. If you stack them up high, vertically I should say, you can print probably 5 to 6 models at a time on the Mini AK or Mini AKS. But honestly, if you're going to be printing models, you're probably going to want to switch over to the Sonic Mighty series, which is just a much bigger build plate where you'll be able to fit double to triple the amount of models that you will with these printers. But again, I've had amazing success with these printers. I was recently ready to upgrade and spend big bucks on a dental specific printer until I realized by adding these modifications, I was able to get a 3-unit bridge printed in 20 minutes, 22 minutes to be exact. And at that rate, with that success and accuracy when I put in the mouth, for me to justify spending $10,000 on the printer to cut off 10 minutes of print time doesn't quite make sense. My guess would be if you're printing a hybrid with these modifications, you'd probably come in around a 30-minute print time. So you can do it about 10 minutes probably on a $10,000 printer, or about 30 minutes on one of these modified Mini AKS printers that's modified for dental resin. So I hope this helps. Really great printers. The only thing you have to really take into consideration is when you're going to spend the money. The cost of the printer is usually not where you want to spend the money. You want to spend the money on a really quality curing unit. I like the Auto Flash, and the Auto Flash is validated for a lot of these dental specific resins. You can buy a cheap curing light in the event that you're just doing models, but if you're putting it into a patient's mouth, you really want to make sure you're following the instructions for use of each one of these resins, and they will tell you which curing lights they're compatible. So before you choose your curing light, I would research the resin that you plan on using and find out which curing lights are validated for that resin, because that's the ultimate decision. Is if you put something uncured into the mouth, that's when you may run into problems with sensitivity and allergies and things like that. So curing light, super important. As far as the wash is irrelevant. Most of these type of intraoral resins, you're going to spray down with an alcohol spray bottle. You're probably not going to be using a wash anyway, because dental specific resins typically don't want to be in a bath more than 30 seconds. You're going to have better success cleaning these intraoral resins with a alcohol sprayer and some kind of high compressed air that you can buy an electric, or you can hook it up to your unit if you want to as well and add a modification to your dental compressor. So I hope this helps. Great printers, tons of success. If you're not into 3D printing, you definitely should be. And again, these are the best entry-level printers I've seen on the market. And in my opinion, you're probably going to get better results than more of the dental specific printers on the market. And truthfully, a lot of these printers, whether you spend $200 or $10,000, they become out of date within 1 to 2 years. So the thought for me of spending a lot of money on something that's going to be outdated that quickly, I'm not a big fan of doing it. So be careful choosing the printer that you decide to go with. So thanks a lot. Hope this helps. Have a great day.